We have the inner carotids that will come across. This one got shot. Comes across here, comes across the throat. External carotids are above the internal carotids. Below the inner carotids are going to be called the common carotid. So this is the common carotid, this is the common carotid. But above that, they're going to be called the external carotids. So we're going to follow it all the way down here to the brachiocephalic, right here. Then we're going to come all the way here, and then this is going to be the intermammary, right there. Then this is the vertebral, right here. Then this, right in between here, this is called the subclavian. It's all one, but that's called the subclavian. Down here it's called the brachiocephalic subclavian. Then you have the vertebral. Then right here, hopefully it's not shot on the actual cat. Right there is going to be the costal cervical, and then the next one right here, it's like the other nub right here, is going to be called the thyrocervical. Then this part is going to be the auxiliary, just like the vein. This part's going to be called the brachial, and then it's going to split into the radial and ulnar. So very similar to the veins in that take. Then you're going to come down here and you're going to have the aortic arch right here, right there. You can see that. Here. And you're going to come, and also the pulmonary trunk coming off right somewhere around here. If you know your basic heart anatomy, you should be able to find it. Should be. Big question mark there. Then you come down again, the pulmonary trunk, which is right here. Come down, all these little ones right here are your intercostals. Right here, okay? Then it goes into the thoracic aorta, right above. Thoracic aorta starts here. Correct? Yes. Thoracic aorta starts right there, right before you get to the diaphragm. Then underneath the diaphragm, this would be called the abdominal aorta, right here. So above the diaphragm's thoracic aorta, below the diaphragm's abdominal aorta. So then then it goes into the celiac trunk, which is right here. This right here, even though there's two of them, that is the gastric, and then this right here is the hepatic. Gastric, hepatic, and then this lovely branch right here is the splenic, right here. So then below that, right here, going to the nice intestines, is the superior mesenteric. The artery should be going right through here to the adrenal gland is the adrenolumbar, and the artery below, underneath this, going to the kidneys is the renal artery. Again, you have a bunch of little lumbar arteries here. This right here is the inferior mesenteric. So you got the superior mesenteric, inferior mesenteric, both go into the intestines. You got the iliolumbar right here. Got the external iliac coming off here. Then you have the internal iliac coming off right here. Then you get into this, you get your femoral, your deep femoral artery here, and then your popliteal artery here, and then your sphenius artery here, and then medial sacral artery comes way deep down here. You can barely see it. It's like right along with the, it's right there. And that is arteries.